day in the life. Whoever thought that in this era of COVID, we would be talking about a day in the life as it is today. And yet here we are. As Charles Dickens said, these are the best of times and the worst of times. In the age of light, there is also some age of darkness. And from the winter of despair comes incredible spring of hope that we're seeing now. And that is so true today in this unbelievable pandemic that has really swept not only America, but all of the world. So I'm going to share with you what my life has been like from the time that we stopped operating almost 2 weeks ago, as we want to not only do the right thing, but also to protect our patients, our families, and ourselves. So you're going to see an evolution of what I've done from the morning routine, a focus on being purpose-driven, doing the right thing, not only meditating, but doing exercise, but also giving back, seeing my postoperative patients only, teaching in different venues from all around the U.S. Virtually, online, via Zoom, from Michigan to California to Baylor College of Medicine in Houston. You'll see all of those things, to interacting via Instagram Live with a lot of my colleagues, teaching and giving back, to doing Zoom educational conferences with our residents and fellows, teaching them about what's next, and most importantly, emanating positivity, positive vibes. You must emanate positive vibes, hope over despair, positive over negative, and we will come out of this be better than ever. Mark my word. Enjoy the day of the life. So this is our new attire for going to work, COVID-19. I'm getting used to it. We will get through this, be better than ever. Mark my word. Wear your mask. False boards and some just, and so I always hear, Ash, when patients come to me for a revision rhinoplasty like you, they say, but he had a great office, he had a great website, and he had a lot of certificates. Well, the problem is, if you have to have one that says certified by the American Board of Plastic Surgery. And the other thing you said that's important is that board certification is getting you in the ballpark. I do it in the ballpark, because then you have to find out, what are they really good at? Are they specialized in, rhinoplasty or buttock augmentation? So it's way beyond just, are you board certified? But at least it gets you in the ballpark.
Yeah.
And I think that's what people, everybody's famous on their own website and Instagram, as you know, in LA, right?
Yeah, I mean, LA, you can be 2 months, 6 months out of your residency and haven't even taken your boards yet, and you can advertise you're world famous, and that can be anywhere. And obviously, it happens more often in competitive cities like LA, New York, Miami, probably in Dallas a little bit. But
oh yeah, it happens a lot here.
Not for us, but for our providers.
Okay, but you have masks, right?
Yeah, we do right now, so that's good.
Yeah, is there a lot of COVID there?
No, we've only had 5 confirmed cases, I think, so far. But, it'll get worse before it gets better.
Right, it'll get worse later in the month, so be safe. So.
Thank you.
All right, well, good. We show more graphic things on the stories, not the posts, because we know that, my audience is a lot of plastic surgeons, so that's different. But you want to attract consumers, you want to attract patients. So you generally, what they like to see is they like to see pre and post-ops. Pre, post-ops, sometimes intra-ops, it's not, going to be, maybe shocking to them, any intra-op, no blood. So I think I would do that. I think that's fine to do. In the last couple hours since I said I would do this, and so I've gotten a lot of questions. I think the biggest thing is it's really centered around COVID and life and plastic surgery. So I'm going to try and separate it out into 3 different areas. Now, all of us have been totally affected by COVID, and I'm not a COVID expert, but as a physician, I'll tell you what I tell my patients. and my family and friends. I mean, I think follow the CDC guidelines, you know, stay home, stay healthy, stay focused, and, you know, avoid the, you know, touching your face. Social distancing is important. And I'm a huge advocate of what the CD finally has recognized. It's wearing a mask. I think a mask for all is so important because it protects yourself and others, especially in group areas or when you go grocery shopping. And of course, all the other questions I had about COVID is, what do you do and how long is it going to last? Nobody knows. I mean, I think those daily briefings are great. Dr. Fauci and Brooks are actually excellent with their daily briefings and updates, and it's going to be a while. Until we have true herd immunity and a vaccine, you know, we are not going to be totally out of range. But I think life will return to normal. We will, but it's going to be different in different parts of the country. We have to flatten the curve. That's so important. Thank you so much for giving me this time with you, and look forward to doing more live Instagrams. Have a great day. As you've seen, it's been certainly an era of change. You've seen the rhythm of going to do surgery daily and seeing patients daily to that of being very structured in a virtual reality, virtual consultations, virtual teaching, online follow-ups, learning a whole new and different way of life. But that is very, very important. And most importantly, you have to remain purpose-driven, positive, hope-driven, all those things that you'll see that emanates from us as we move forward. See you next week.